Okay, so let me move on to the next, really important award, the Rhoda and Bernard Sarnat International Prize in Mental Health. This award has been given annually since 1992 to individuals, groups, or organizations that have demonstrated outstanding achievement in improving mental health. The Sarnat's concern about destructive effects on mental illness inspired them to establish this award. Rhoda passed away early this year, and her husband Bernard passed away in 2011. However, their legacy lives on through their deeds, and of course, through this award and the deeds of the award recipients. I'd like to invite Margarita Alegria, chair of this year's selection committee, to the stage to introduce this year's Sarnat Award recipient. Margarita? Great to see you.
This year, I'm incredibly honored to be chairing this committee. This award is supported by an endowment created by Rhoda and Bernard Sarnat. Rhoda Sarnat was a licensed clinical social worker, and Bernard Sarnat was a plastic and reconstructive surgeon and researcher. They were really concerned about mental illness. I want to say I'm delighted this year to present the award to Kenneth Wells. He's the David Weil Endowed Chair and Professor at the David Geffen School of Medicine, Fielding School of Public Health, and Semel Institute at the University of California, Los Angeles. He's also affiliated staff at the RAND Corporation and staff psychiatrist at the VA West Los Angeles Medical Center. Ken has worked help establish the field first of quality of care and outcomes assessment within mental health. For example, his work on the RAND health insurance experiment described the impact of variations in insurance coverage on mental health service use, cost, and mental health quality of life outcomes. His works on the medical outcome study, which focused on depression as a tracer condition for assessing quality of care and outcomes, show that depression is a strong contributor to impairment in function and quality of life. Wells also developed the Partners in Care, a multi-site clinical level study which demonstrated that encouraging primary care practices to implement quality improvements for depression led to improved quality of care across ethnic and racial groups. Actually, for a long time, this study was followed longitudinal and show impacts after a long time. So improved depression outcomes and employment status, but very importantly, reductions in racial and ethnic disparities in mental health outcomes, while still being cost-effective relative to commonly used medical treatments. Ken also helped lead a community partner participatory research initiative, Community Partners in Care. This evaluated an expanded model of depression collaborative care training for providers in healthcare and alternative community-based programs in under-resourced communities. In fact, some people thought Ken had taken the wrong path, but he proved them completely wrong. This won several national and international awards, and it was identified in a Cochrane collaborative review as one of the first studies to demonstrate the effectiveness of coalitions relative to an alternative model to affect health of minority communities. This model was also used in the mental health recovery in New Orleans, post-Katrina, and other post-disaster areas. In addition, Ken has made a significant contribution to building capacity for mental health services research. He has mentored over 200 fellows and junior faculties who went to become leaders in their fields. So Dr. Wells has given us knowledge and commitment to make a difference in the lives of people with mental health conditions, especially those with disparities in access to mental health services. He is very deserving of this award.
Thank you very much, Dr. Alegria, my dear friend, the Sarnat Committee, and the National Academy of Medicine for this wonderful honor. This award recognizes work conducted by many contributing colleagues, patients, and community partners. For me, in particular, UCLA Semel Institutes and Schools of Medicine and Public Health, the RAND Corporation in Greater Los Angeles, VA. Also, my mentor, Robert Brooke, and colleagues and former mentees who were here, Jeannie Miranda, Bowen Chung in Los Angeles, Benjamin Springate, and colleagues in New Orleans, and colleague and mentor Myrna Weissman, and also important to me, David Satcher, Gary Gottlieb, Vikram Patel, and many others. And for our community-partnered research in under-resourced communities, Loretta Jones of Healthy African American Families, too. On the personal side, I thank my wife and life supporter, M. Christina Benson, MD, and sons, Matt and Mike Wells, and their children, my grandchildren, Robin and Dake Wells, my sister-in-law, Dea Benson, who's also here. My message in a few seconds is that we can extend the scope of research in medicine to partner with and study together key issues affecting communities, including under-resourced communities, and through partnered research to work together for a more equitable world, including for addressing mental health and behavioral health issues. Further, it is critical for improving quality of life to also address social determinants of health that increase risk for and also can worsen quality of life for mental health conditions. We now have the tools and commitment to work together as partners in science for community transformation, to learn how to achieve mental health equity. As community partner Loretta Jones says, we, us, and our, for engagement and endowment in life. Thank you.